is Justine Turner and I'm a Wright State nursing student. My other group members are Katie and Jenny. Our group's topic is behavioral approaches for hallucinations. So to start off, what exactly are hallucinations? So hallucinations are abnormal perceptual experiences. And those experiences can be visual, auditory, olfactory, gustatory, and tactile that occur without external stimuli. Although hallucinations may involve any of the senses, auditory hallucinations are the most prevalent. What do auditory hallucinations consist of? So most common auditory hallucinations consist of threatening/accusatory voices commenting or conversing on the individual's behavior can also occur. Hallucinations are under the umbrella of positive symptoms, so that involves additions to normal experiences. So why do hallucinations occur? So it's not known whether hallucinations serve adaptive functions in patients with psychotic disorders. Most theories of the cause of hallucinations postulate that the symptom is more likely to occur if it serves a psychological purpose. So cognitive behavioral theorists suggest that hallucinations may be self-reinforcing by reducing arousal, limiting incoming stimuli, or alleviating unpleasant effects. According to this view, the payoff value of internal versus external stimuli help determine which will prevail. Psychodynamic theorists have proposed that hallucinations serve to gratify childhood wishes, restore lost objects, master traumatic experiences, and project unstable impulses, regulate anxiety, and enhance ego and superego functions. Biological theorists suggest that the idea that neurologically based hallucinations are modifiable by interest or attention. However, all these theories agree on the distressing qualities of hallucinations. So what disorders do hallucinations occur in? Approximately 3 million Americans, which is 1% of the population, suffers from schizophrenia spectrum disorders and other psychotic disorders. Major psychotic disorders under the spectrum include schizophrenia, schizoaffective disorder, delusional disorder, and a brief psychotic disorder. The neurological illnesses are among the most chronic and disabling of severe mental disorders, causing psychotic symptoms such as hallucinations. How do clients respond to these hallucinations? So as you can imagine, clients who experience perceptual disturbances respond with fear and anxiety. What is the treatment for someone who experiences hallucinations? So my fellow group member Katie will be discussing the treatments and effects of certain behavioral approaches to treat these hallucinations.
Hello, my name is Katie, and now that you have learned what a hallucination is, we are going to discuss ways on how to reduce hallucinations using behavioral changes. One way to reduce hallucinations can be for a person to tell the hallucination no or to go away. Another way to reduce hallucinations can be to find activities to distract them. Some activities that a person can participate in could be watching TV, listening to music, or playing a board game. Another technique that can be used to reduce hallucinations can be to put an earplug into one ear. This can help reduce the noise activity, all while still letting that person live their life. If you see someone that is experiencing hallucinations, approach them calmly, quietly, do not sneak up on them, and be aware of their verbal and nonverbal cues. If someone tells you that they are experiencing hallucinations, acknowledge what they're experiencing, but state the reality that you do not hear or see anything. Finding a coping strategy that works for that person is very important, and helping to provide safety for that person. The benefits of using behavioral changes to reduce hallucinations can include that person not having to experience the trials and errors of pharmacological intervention. Using behavioral changes to reduce hallucinations can also cut out the side effects that come along with many medications that are prescribed for people experiencing hallucinations. Finally, behavioral changes to reduce hallucinations can give a person a feeling of being more in control of their life.
Hello, my name is Jenny and I'm going to be talking to you today about cognitive behavioral therapy and how it can positively affect some sides of hallucinations. Earlier we spoke about what hallucinations are and what exactly they do to the body, as well as some day-to-day activities you can do to get rid of the hallucinations. We also know that most symptoms of psychosis are treated with antipsychotics in combination with something else. So that brings me to our next point. Something called medication refractory period, which is essentially our body's way of taking that medication and making it unuseful, so therefore it doesn't work on any of the side effects of hallucinations. A lot of times we see trial and error with medications in mental illness, which can be very frustrating for the patient, as well as just making them feel like, they're losing hope. So what do? Do we give up? No, of course not. Instead, we teach the patient ways to self-manage their symptoms using cognitive behavioral therapy, better known as CBT. CBT is an approach that is geared towards client-specific needs. Everyone's hallucinations aren't the same, so we don't want to treat them the same. For example, if a client verifies they're having visual hallucinations rather than voice, some CBT treatments include aversion therapy, environmental changes in response to the visions, and relaxation therapy, all of which includes the client's preferred method of treatment, getting feedback on what works best and what is not helpful at all. Involving the client in the plan of care most often gives them a sense of control. This is extremely important with mental illness because it's something they tend to lose control over. While CBT may not be the cure-all for all positive symptoms of psychosis, it allows the client to gain some control and distract their mind. Some evidence-based practice says that CBT in combination with routine care, such as oral antipsychotics, is more beneficial on the positive symptoms than medications alone.